all, and welcome to our digital presentation for the Youth Tech Health Conference. In this presentation, we will address mHealth solutions for mobilizing field staff and volunteers to Kenyan children with disabilities during COVID-19 and beyond. Our team consists of Boston University School Public Health students who have paired with members from Kupenda and Kuhenza for the children for the past 5 months to make this all possible. And these members consist of Laura Holtz, Mansi Barma, Caroline Flessa, and Julia Nash. And on to Julia for a little bit more about our project.
So who is Kupenda and Kuhenza for the children, and what do they stand for? So Kupenda for the Children is a 501c3 nonprofit organization based in the United States, which works alongside its affiliate Kenyan organization, Kuhenza for the Children, to ultimately improve the lives of children with disabilities. Their mission is to transform harmful beliefs related to disability and improve access to medical care, education, and community inclusion by working with individuals impacted by disabilities and their families and communities. So next, we're going to talk a little bit more about the application that we worked alongside Kupenda and Kuhenza. So I'm going to pass it back to Laura.
All right. So overall, children with disabilities are at higher risks for contracting COVID-19 because of barriers regarding accessibility to information, hygiene, support, and other underlying medical conditions such as respiratory and immune challenges. Some examples of these barriers include children who are isolated at home with no socialization, children who lack adequate nutrition, and children who do not have access to appropriate high-quality education. The combination of COVID-19 and stigma exacerbate the conditions faced by children with disabilities, leading to higher rates of morbidity and mortality. To address these issues, Kupenda for the Children in the US and Kuhenza for the Children in Kenya are working together with a community of Kilifi County in Kenya to support counseling and home-based care for children with disabilities. These nonprofits have partnered with the Boston University School Public Health team to create a mobile health application to help community leaders monitor and assess the care of children. The application documents remote outreach to children and their families, and it also has educational tools to teach children and families about COVID-19 and connect them to necessary services. And on to Mansi for a little bit more about the background.
Before we talk about our mobile health intervention, it's important to know how Kupenda and Kuhenza's work has changed since COVID-19. During COVID-19, the mandatory stay-at-home order has dramatically changed the conditions for children with disabilities. Because of the stay-at-home order, many family members are left unemployed, and these children are left in more impoverished conditions. In addition to this, children's necessary supportive services such as medical care, education, food, and sanitation that Kuhenza provides have been limited. And because of all these challenges, Kupenda and Kuhenza have decided to actually continue their outreach work in the community with children and their families remotely. Some of the ways that Kuhenza and Kupenda are continuing the outreach work with the application is by doing all outreach work through phone, WhatsApp, SMS, to continue to counsel families on how they can take care of their children who have disabilities. Now going on to my partner, Caroline.
So when we created our mHealth application, it was designed for child outreach. And in this application, we added a COVID-19 screening, a COVID-19 prevention counseling form, as well as educational resources related to disability, like a handbook and a home visit guide. And this was all done to adapt the application in accordance with user feedback that we were receiving pretty consistently. And so our application has also been a pathway to gaining more funding needed for increased operational support, which is fantastic. This has been a way for us to expand operations around the mHealth application, such as more staff being trained, phones were being given out, solar chargers, phone cards, and more staff have been hired. And also we were able to create video tutorials using subtitles for demonstrations. And this app has also been a great way to collect data for measuring the impact of outreach activities. And the outreach activities have been reaching the at-risk children, and generally the outreach activities have been measured in ways such as the numbers of referrals being made and how many are being used. And so the results being reported will now be explored more by Julia.
So what results have we seen, and what benefits have they ultimately yielded? Our application to date has had a tremendous impact, having supported 300 children with disabilities in a single month, which was June of this year, compared to 1,000 children that were served in the entirety of last year. So on average, about 83 children per month. And what our application has been able to do is for staff and ultimately community leaders to submit real-time reports on child and family needs, tracking health outcomes in real time. And staff are able to prioritize outreach to the children most at risk for malnutrition, medicine noncompliance, COVID-19 infection, transmission, and illness, while also being able to monitor and assess staff and volunteer outreach goals and activities. So really, the next steps around app enhancements for a greater impact do include compiling and cleaning the data from our application, really to build follow-up measures to continue supporting children most at risk, and in one way by developing an emergency care follow-up component to ensure that children are receiving timely care, as well as training more staff, leaders, and volunteers to use the application to continue to reach more children. And so next we'll tie it all together in our conclusion.
So a lot of our success for our mobile health intervention come from our team's ability to quickly adapt to COVID-19, the rapid community feedback we got while creating this application, and the operations to support it. Both our US and Kenya team were able to dramatically adapt to the changes of COVID-19 and go through the iterative process of creating a mobile health application. Specifically, our Kenya team was great at providing us rapid feedback and on how our application worked on the outreach side. And our outreach efforts were bolstered by the fact that we had operational support such as phones, phone cards, and solar chargers to help continue our outreach efforts. And so we hope our presentation has given you guys some understanding that you can continue on your work during COVID-19 and have the same kind of success, if not more, if you have the right kinds of operations and teamwork to make it happen. If you have any other questions about our presentation, feel free to reach back to Jessica Charles, the Director of Operations for Kupenda. Thank you so much for your time.